Identify the instrument. A. Ilicerous fixator. B. Rail fixator. C. K nail. D. Proximal femoral nail. The correct option here is B. Rail fixator. Now let us see one of the fixators one by one. Ilicerous fixator. Ilicerous fixator was developed by Gavril Abramovich Ilizarov, a Russian scientist, who described the law of tension stress, that is, principle of a new tissue develops between the distracted bone ends. The indications of Ilizarov's fixator are limb lengthening, arthrodesis, infected non-union, deformity correction, etc. Now coming to rail fixator. Rail fixator is a monolateral fixator available in the form of rail or a telescoping multi-joint assembly. In this, 6 mm pins are inserted into the bone. These pins are attached to different blocks which can move over a tract. According to need, the bone can be compressed or distracted, as in Ilizarov's ring fixator. Then coming to the K nail. K nail or Kunstner intramedullary nail. German surgeon Kunstner made this nail for fixing fracture of shaft femur. It is a hollow, incomplete tube, and there is a slot or gap in the circumference of the hole of the nail, which allows it to bend slightly on the tensile surface of femur. As it is hollow, it maintains bone marrow continuity and preserves bone nutrition, and also allows guide wire to pass when it is used. It has clover leaf cross section. Identify the given splint. A. Dynamic finger splint. B. Sugar tongue splint. C. Cock-up splint. D. Knuckle bender splint. The answer to the given question is C. Cock-up splint. Cock-up splint can be used for wrist pain, Beecher veins disease, Coles fracture syndrome. Sugar tongue splint, knuckle bender splint, it simultaneously flexes MCPs of all digits, metacarpophalangeals of all digits without blocking IP or wrist motion. This knuckle bender splint is used for ulnar nerve palsy. So the correct option here is C. Cock-up splint. A football player falls on outstretched hand while kicking the ball and felt pain at the wrist joint immediately after falling. Identify the fracture. A. Galeazzi fracture. B. Coles fracture. C. Montague's fracture. D. Rolando's fracture. Now let us look at one by one. What is Montague fracture? Montague fracture is defined as a proximal one-third ulnar fracture. Proximal one-third ulnar fracture, and with an associated radial head dislocation. It is Montague fracture. Now, Montague fracture. Now, Galeazzi fracture. Galeazzi fracture is fracture of lower one-third of radius with dislocation of distal radio-ulnar joint. Fracture of lower one-third of radius with dislocation of distal radio-ulnar joint. The mechanism injury is fall on the hand, probably with superimposed rotation force. So the correct option here is A. Galeazzi fracture. What is the use of given instrument? A. To hold the bone and plate. B. To hold the fragments with traction. C. To cut the bones. D. For creating a gap in the wound. Plate holding. This is a plate holding force. During an open reduction and internal fixation, these are used to hold the plate in alignment while drilling and screw placement takes place. So the correct option here is to hold the bone fragments with traction. Earliest sign of compartment syndrome is A. Tingling or numbness. B. Skin mottling. C. Pulselessness. D. Pain on passive touch. Correct option here is pain on passive touch. Now compartment syndrome. Compartment syndrome is more common in lower limbs. High risk injuries are fracture of elbow, forearm, bones, proximal third of tibia, multiple fractures of hand or foot, crash injuries, and circumferential burns, characterized by pain with passive motion of fingers and toes, pulselessness, pallor, paresthesia, poikilothermia, and paralysis. Pulselessness, pallor, paresthesia, poikilothermia, and paralysis. Pain out of proportion to clinical situation is usually the first symptom. Pain on passive touching is the most sensitive sign prior to onset of ischemia. Late signs of compartment syndrome are paralysis and pulselessness. So the correct option here is D, pain on passive stretch. What is the most common sequelae of traumatic shoulder dislocation in young adults? It is a recurrent shoulder dislocation. In the fracture seen in X-ray below, what is the most commonly expected vascular injury? It is a supracondylar fracture. So the most commonly expected vascular injury is brachial artery. What is the eponym for fracture shown below? It is Monteggia fracture. An athlete suffers a fracture as shown in the knee X-ray below. How is the fracture managed? This is a knee X-ray. Tension band wiring. Which part of second metatarsal is involved in March fracture? It is the neck. Which of the following is incorrect about PCL? It is a main restraint to internal rotation. C. About giant cell tumor, all are true except A. Commonly presents in 20 to 40 years age group. B. Matrix consists of proliferating mononuclear cells. C. Osteoclast giant cell constitute the proliferative component of tumor. D. It is a benign tumor which may have lung metastasis. So the correct option here is osteoclast giant cell constitute the proliferative component of tumor. What is the diagnosis? Well, this is a giant cell tumor. So correct option here is B, giant cell tumor. Identify the deformity. A, swan neck deformity. B, bottoner deformity. C, jersey finger. D, mallet finger. It is a swan neck deformity. Glucosamine supplementation is given in. It is given in arthritis. Patellar clunk syndrome scar is present at superior port of patella and impinging on the femoral component during extension. Most specific for diagnosing ankylosing spondylitis is bilateral sacroiliitis. What is the most likely cause of abnormality seen in wrist X-ray of the child given below? It is rickets. A 75-year-old female had a fall and intertrochanteric fracture. This is due to osteoporosis. A 55-year-old man presents with severe backache for 10 days and urinary incontinence with a history of intervertebral lumbar disc prolapse. There is no history of fever or weight loss. What is the likely diagnosis? A. Port spine. B. Multiple myeloma. C. Cauda equina syndrome. D. Bone metastasis. So the correct option here is C. Cauda equina syndrome. All of the following are true about Sprengel shoulder, except. Now let us know something about Sprengel shoulder. Then we will be easily able to answer this question. All of the following are true about Sprengel shoulder. A. Associated with diastometamelia. B. Most commonly associated with Klippel-Feil syndrome. C. Usually associated with dextrocardia. D. Associated with congenital scoliosis. The answer here is usually associated with dextrocardia. It is not associated with dextrocardia. Sprengel shoulder. Sprengel shoulder is not associated with dextrocardia. What is the likely diagnosis in the image shown below? A. Coxa magna. B. Coxa valga. C. Coxa vara. D. Coxa sultans. C. It is Coxa rara. Meralgia parasitica is due to involvement of A. Lateral cutaneous nerve of thigh. Identify the deformity seen in the given picture. A. Hallux valgus. B. Hallux varus. C. Cubitus valgus. D. Rheumatoid nodule. It is Hallux valgus. Haglund's deformity is seen in which joint? It is seen in ankle joint. So let's once again do all the questions one by one. Identify the instrument. It is a rail fixator. The splint is cock-up splint. Football player falls on outstretched hand while kicking the ball and felt pain at the wrist joint immediately after falling. The fracture is Gallagher's fracture. What is the use of given instrument? It is used to hold the bone and plate. Earliest sign of compartment syndrome of leg is pain on passive stretch. What is the most common sequelae of traumatic shoulder dislocation in young adults? It is recurrent shoulder dislocation. In the fracture seen in X-ray below, what is the most likely expected vascular injury? It is a supracondylar fracture, and the vascular injury is brachial artery. What is the eponym for fracture shown below? It is Monteggia fracture. An athlete suffers a fracture as shown in the X-ray below. How is the fracture managed? It is managed by tension band wiring. Which part of second metatarsal is involved in mass fracture? It is neck fracture. Which of the following is incorrect about PCL? It is a main restraint to internal rotation. About giant cell tumor, all are true about except osteoclast giant cell constitute the proliferative component of tumor is not true. What is the diagnosis? It is a giant cell tumor. Identify the deformity, swan neck deformity. It is a swan neck deformity. Glucosamine supplementation is given in arthritis. Patellar trunk syndrome is presented. Superior pole of patella and impinging on the femoral component during extension. Most specific diagnosis for diagnosing ankylosing spondylitis is bilateral sacroiliitis. What is the most likely cause of abnormality seen in the wrist X-ray below? It is rickets. A 75-year-old female had a fall on intertrochanter fracture. This is due to osteoporosis. A 55-year-old male presents with severe backache for 10 days, urinary incontinence with a history of intervertebral trauma, lumbar disc prolapse. There is no history of fever or weight loss. The likely diagnosis is quad icona syndrome. All of the following are true about Sprengel shoulder. It is usually associated with dextrocardia. What is the likely diagnosis of image shown below? It is coxa vara. Meralgia paresthetica is due to involvement of lateral cutaneous nerve of thigh. Deformity seen here, hallus valgus. Haglund's deformity is seen in which joint? Anthoid.